Hello everyone. Social Pharmacy Unit 5, Indian Health System, National Health Programs, Pharmacist. What is health system? Health system means healthcare services, hospitals, doctors,
Pharmacist.
nurses, government health programs, medical facilities. Main aim of health system: disease prevention, health promotion, treatment, rehabilitation, better quality of life. Levels of healthcare. Healthcare system, 3 levels, divide. 1. Primary healthcare. Healthcare system, basic level. Examples: subcenters. PHC, primary health center. Services provided: vaccination, basic treatment, maternal care, health education. Important point: rural areas, primary health care. Pharmacist role: medicines dispense, patients, counseling, health awareness. 2. Secondary healthcare. Disease, serious, patient secondary healthcare. Examples: district hospitals, CHC, community health center. Services:
Specialist doctors.
laboratory tests, emergency care. 3. Tertiary healthcare, advanced healthcare level. Examples: IMS, medical colleges, super specialty hospitals. Services: major surgeries, ICU care, advanced diagnosis. National health programs in India: government health programs, diseases control, public health improve. 1. National Tuberculosis Elimination Program and TB.
RNTCP.
Objective:
TB.
early diagnosis, free treatment. Symptoms of TB: weight loss, fever, blood in sputum.
DOTS therapy.
DOTS means directly observed treatment short course. Patient healthcare worker. Pharmacist role: anti-TB medicines, patient adherence maintain. Side effects. 2. National AIDS Control Program NACP.
AIM.
HIV infection, awareness, free art therapy, HIV transmission, unsafe sex, infected blood, needle sharing, prevention, safe sex, sterile needles, blood screening. Pharmacist role: art medicines dispense, counseling, patient support. 3. Universal Immunization Program UIP. Program, dangerous diseases. Vaccines included: BCG, OPV,
DPT.
hepatitis B, measles vaccine. Importance of vaccination. Vaccination immunity.
Cold chain.
Vaccines, temperature, store. Pharmacist role: vaccine storage, cold chain maintenance, awareness campaigns. 4. National Vector-Borne Disease Control Program. Diseases included: malaria,
Dengue.
chikungunya, filariasis.
Cause.
Mosquito bites. Prevention, clean surroundings.
Mosquito nets.
Avoid water stagnation. Pharmacist role: ORS and medicine supply. Public education. 5. Reproductive and Child Health Program RCH. Objective: mother and child health improve. Services: antenatal care, safe delivery, family planning, child immunization. Pharmacist role: iron and folic acid tablets, contraceptives provide, counseling. 6. National Leprosy Eradication Program.
AIM.
Leprosy detection and treatment. Symptoms: skin patches, loss of sensation. Treatment: MDT, multi-drug therapy. Pharmacist role: MDT medicines, awareness. 7. NPCDCS Program. Full form: National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. Objective: lifestyle diseases control. Causes:
Smoking.
obesity,
Stress.
poor diet. Prevention: exercise, healthy diet, regular checkup. Pharmacist role: patient counseling, lifestyle modification guidance. Overall role of pharmacist in health programs. Pharmacist